Okay, one of the set of practical strategy an idea that is aims at reducing negative consequences associated with drug use is a word known as harm reduction, and these have been a movement that have been built on many beliefs and respect that the right of people towards use of drugs. Today on Health Matters, we will be looking seriously on harm reduction, what you should know, its impact and its barrier towards HIV prevention. And most time, a lot of us don't know that drug use is linked to unsafe sexual activity, and it's increasing the spread of HIV infection and more. Today on Health Matters, I remain Samuel Alabi. After this break, we will be continuing and be looking at HIV prevention and harm reduction with my guest today. Don't go away. It is Ed Matters on the wheel. This is Ed Matters on the wheel. Trust you doing fine. Don't go away.
The baby needs a TV for the mother. A child is meant to play. Oh, it's the time to bond with my child.
Because the child is thinking of something that is natural as a disease. It will affect the way they manage those conditions.
Single. Some people don't know that you intentionally set some goals for your family.
There's so much more we need to do when it comes to mental health in Nigeria, because we have one psychiatrist to 1 million Nigerians.
It is Health Matters every Monday and Friday on your number one health radio, Pinnacle Health Radio. Download our 100 app on Play Store or listing via www.pinnaclehealthradio.org.
Okay, welcome back. Today is the 1st December 2017, and globally it's about AIDS. It's about HIV. It's about hate. They'll put the word as AIDS. And, for some people who are really fascinated with what goes on in this, always on Health Matters, there's always a fact sheet. But putting fact sheet aside, because I am coming back to fact sheet, today I have a guest with me. Today, the Director of Equal Health and Right Access Advocacy Initiative, EHRA, Dr. I believe the doctor.
Mr. James.
All right, Mr. James O. Egage. How are you doing today?
Fine, good morning. And happy World AIDS Day 2017.
Wow.
Yeah.
Well, it's really nice having Mr. James with us today.
Yeah.
Equal Health Right Advocacy Initiative, majorly, when I was asking you, said you have been operating for the past 3 years right now.
Yes, 3 years.
Harm reduction, what has harm reduction got to do with HIV itself?
Well, harm reduction itself is it's not really a new innovation.
Okay.
I think this innovation has started way back some decades. And these were interventions that were brainstormed out by experts to see how to reduce harm associated with human behavior. And generally, just not to forget, let's even look at the title of the World AIDS Day 2017. It says, Increasing Impact Through Transparency, Accountability, and Partnerships. And when the issue of harm reduction came generally in the world today, especially let's factor into Nigeria, is a new term in Nigeria because of the increasing HIV prevalence currently in Nigeria. Government is having really challenges reducing infection, putting people on treatment. There's no readily available large amount of ARVs for people who really need it. That is persons living with HIV who really need that HIV treatment. And for us to prevent new infections, the concept of harm reduction came to being. So harm reduction is just primarily addressing you as a person.
Okay.
It's non-judgmental.
Okay.
It doesn't care about your behavior. You might be a drug user, you might be a sex worker, you might be a man who has sex with man, or a male sex worker. It doesn't look at your behavior. It's just addressing more, reducing harm associated with your choice behavior, and seeing how to inform you so that you can make the right decision as a human being with respect to your health.
All right, that is really cool. Harm reduction. It's just like when we had the issue of antibiotic resistance, and people are asking the question of, is it a reemergence or is it a new thing? So the main program itself is it something that's just on right now, or it has been operating for a while now?
It has been operating for a while. Many countries, let's take the context of Africa, many countries have started adopting harm reduction into their program, like Kenya, Tanzania, South Africa. Even in West Africa here, Cameroon have started harm reduction programming. Benin Republic has started. Ghana, Senegal. Nigeria is left behind.
So it's like we're actually not doing anything. Well, it's a low, the work itself is actually not reaching the number of people we have out there.
Yeah, Nigeria itself, let's go back to our culture too, our character. Somehow we are not so receptive accepting new policies, which are very beneficial, except when we have a calamity.
All right.
That's when we now say, there's something somebody talked about, harm reduction. There are concepts researchers come about on harm reduction. Okay, let's go to it to save ourselves. Currently, Nigeria has a prevalence of 3.9 million people living with HIV. And also, the HIV prevalence among general population is 3.4%. Government say is reducing from 4.2 in 2010 to 3.4%. That's what our government say, according to the data from the IBBSS survey conducted in 2014. That is Integrated Biological Behavioral Surveillance Survey on HIV. But currently, we are having new incidences of HIV coming up in Nigeria, rapid ones. The prevalence among general population in Nigeria is 3.4%, the same with the national HIV prevalence. But among key affected population, those are the bridge, the gap, those are the people that stand at the middle. And this key affected population includes men who have sex with men, female sex worker, and persons who use drugs. And the government somehow pays a deaf ear to say maybe these people don't exist, or because of our religious background, we don't want to pay attention to them. We feel that they are demonized human beings, they are criminalized. But these people belong to the society one way or the other. They are friends. We might not know that they practice some sexual behavior. They are colleagues, they are fathers, they are mothers, they are in-laws. So Nigeria has to pay attention to this key target population. From the prevalence survey in 2014, it says the men who have sex with men target population record a 22.9 HIV prevalence, the highest in Nigeria. And female sex workers record 19.4%, while persons who use drugs, 3.4%. But alarmingly, female members of the community who use drugs, that is female women who use drugs in Nigeria, recorded a prevalence of 13.9%.
Is that a year data or what?
It's a data conducted in 2014.
That's what I was
talking about. But currently now, next year, possibly another data and survey will still be going on. But we are looking big because Nigeria looks based on those general national surveys conducted. So the last one was in 2014, and that's the data we are reading now. But currently, incidences are increasing now, so we don't know what's going to happen next year's data, how it's going to look like.
All right, if you are just tuning on, we are still on Health Matters, and I am here with Director of Equal Health and Right Access Advocacy Initiative, Mr. Egage James O. All right, if you want to forward a question to us, remember you can tweet at us today at Pinnacle Health Radio, and also the phone line is open 09059012801. Very easy number to call 09059012801. Back to my guest today. Now, I actually want to know the impact of the harm reduction, because we are saying it's an idea, it's a strategy that has been on ground. What is this impact on HIV itself? Is preventing it or to stop it or to reduce it? It is relation to HIV itself.
Yeah. Harm reduction is just talking about reducing the impact of your behavior.
All right.
So that it doesn't increase HIV or it doesn't increase AIDS or any other deadly sexual transmitted disease. And the aim of harm reduction is centered on you as a person, as in centered on the client itself. Just as I say, harm reduction refers to policies, programs, practices that aim to reduce the harm associated with the use of psychoactive drugs, that is in relation to people who use drugs, who are unwilling or unable to stop. The defining features are the focus on the prevention of harm rather than prevention of drug itself. The focus is on the person who uses
Who uses
drugs.
and the harm that comes along with it.
Yes, it's not focused on telling you, oh, we are criminalizing you or throwing you in jail because you're a drug user. No.
Okay, so which means out throughout these stories, there's a story that came up on that's concerning the actual people that were talking about smoking drugs
Yeah.
can lead to open sores. You hear people having burn or cut on the lips and also
Yeah.
in the mouth, and you see I hear people having blood from these wounds,
Yeah.
and they can contaminate the other because maybe you pick a cigarette and you pass it to the next smoker.
Yeah.
Is this the harm we're talking about?
Yeah, those are the harms we're talking about. With good education, such harm can be minimized. But the only challenge you're having is that are these people willing to come out? Is the health system willing to understand issues that affect persons who use and inject drugs in Nigeria? The health system, first of all, needs to know this community well. Health professionals need to be trained on how to address issues affecting men and women or young persons who use and inject drugs. By that, we can be able to give good education and help such ones to reduce harm associated with sharing of bunkers when smoking, associated with knowing when you have a limit, a wound in the mouth, attending to your wounds, even if you are a drug user itself. So it's associated with helping you to reduce harm, paying attention to yourself, even if you have a particular drug-using behavior, not overstepping your boundaries, educating the person not to overstep the boundaries, not necessarily telling the person to stop drugs.
Okay. Really cool. We are still with Mr. James Agage, and it's still on Health Matters. We are looking at harm reduction, the effect and the way the best strategy adopted can help to prevent HIV spreading across, especially among the youth. When we come back from this break, we're still looking at a lot of things with Mr. James Agage. Stay tuned and don't go away.
Information and education on best feeding practices, on child nutrition issues, has helped many parents and caregivers to make best and informed choices when feeding their children. With Pinnacle Akiola, your child nutrition, reducing rate of malnutrition in our country is possible. Join us Tuesday on 1:30 p.m. on the Child Nutrition Show. This is an awareness program for all women and all mothers out there on the best feeding strategy for your children. On your number one online health radio, Pinnacle Health Radio. Don't miss it. Don't miss it. Don't miss it.
All right, welcome back to Still Health Matters, and today we are looking at harm reduction. For some people, it's not a strange word. It's just that we want to increase more information. We want to get information across to people out there that are really at these stages of harming themselves due to drug uses. If I'm right.
Yeah.
All right. We are looking at harm.
Yeah.
I actually want to hear from you. What are the major harms themselves that comes from the use of drugs?
Okay. If you are somebody who inject, that is needle syringe used to take drugs, there is possibility that you might not know how to inject properly. You got it now? And there are sometimes too, we have needle stick syringe injuries.
Okay.
Maybe as a result of sores, you are injecting the particular place where there is a sore, which you have injected before, and that place has not healed properly. Or you are injecting on the artery. Those are some of the challenges that come with
Use of drugs.
Drug use or mode which you use drugs.
Okay.
You get it now? And sometimes when you smoke too, using a bunker, you have it's an iron. So it goes with blood. Maybe it has a blood stain. It's possible that when other people share that same bunker, it's possibility that they might be infected with HIV. If one person among them is either HIV positive or hepatitis B or C positive.
Okay.
You get it now? Others can share. And also, sometimes to overdose too, maybe tablets, some swallowed by tablet. Maybe they want to take something like stress to reduce stress. And sometimes people can overdose a particular tablet just to be able to get the feel of it. Maybe you are taking one before and you feel you are not getting the feel of it, you go to 2 or 3. Just as Nigerians abuse Panadol or paracetamol. Some people say 2 doesn't work for them at a go. They go for 4. So generally, drug use itself, aside a psychoactive drug user, generally, people abuse drugs in Nigeria, even it spills to the general population. With medicative drugs, people still abuse. And also with psychoactive drugs too, they are also abused. And those are some of this harm that people can encounter, or some of the behaviors that lead to harm.
So let's go to the way forward now.
Yeah.
For actually somebody who is at these issues. Now, we know there's the impact of there's the responsibility health workers should take, but let's come to their own personal responsibility now.
Yeah.
What should they do at this stage?
Nigeria currently, first of all, need to work on its legislation. It's public health, because now we are gradually accepting public health principles into our system. Before, it was more of criminalization.
Okay.
People living with HIV were criminalized back in those days with stigma, discrimination, sent out of work. But with activism, they are able to make their stand known in Nigeria today. And today, at least gradually, people are respecting people living with HIV because they're able to come out. So also, persons who use drugs too, the legislator too has to also look at issues affecting persons who use drugs. Our drug policy legislation, is it favorable? Because our drug policy legislation is more of criminalization, not addressing public health. It's not addressing public health principles at all. So that means a drug user is seen as a criminal. And for people to, for the law to be able to curb such person, they believe that, if we pick a drug user on the street or a female drug user on the street, the next thing we do is to throw the person in prison and talk sense into him. But at the end of the day, it doesn't help the person, because at the end of the day, the person becomes a criminal.
All right.
Just as we say, drug users are not criminals, but the society make them to become criminals. Because when you lock a drug user in jail with a rapist or a hardened killer, what have you made that drug user to become? You are not reducing drugs. At the end of the day, the person comes out to become a criminal. And that's why you now see people picture, drug users are criminals. No. The society make them that. Because when they were drug users, they were looking for help, support. And that's why we have a campaign currently in the world called Support Don't Punish campaign. Support persons who use drugs through rehabilitation, through the legislation, through policies, through training healthcare workers to understand issues that affect drug users and address them using public health principle. But what we are doing in Nigeria is that we are addressing drug users using the criminal law system, and that is not helping matters at all. And that's why we have a lot of persons walking around the road like mad persons, and at the end, it's affecting the economy, because these are brilliant young men and women who are supposed to have been given maybe help, support through mental health counseling and the rest. And by the end of the day, because of discrimination and the way the legislation looks like, some of them end up on the streets and they are wilding away. And Nigeria is going to have a backlash regarding that at the end of the day, because our brain drain is already going. And these are brilliant guys on the street there who would have helped years ago. And we leave them to wander on the street and we call them criminals.
I think I could say, the angle you're already looking at, because actually, we could say that Nigeria, actually, when you see some the particular group that is using drugs, we always tag them criminal. But here you are coming the angle of government coming the best policy, that we should not tag them as criminal. We should see them as someone who need help. And also the second side is that we should also try to put a policy on ground to help them not to abuse and also not to find themselves arming themselves through those drug use. So my whole point is this. Which one is more better? Should we work on the aspect of people not to use drugs or people not to harm themselves?
Let's be very true to ourselves. Drugs are everywhere around the world. We cannot stop people from using drugs. Whether medicative overdose or whether psychoactive drugs overdose, there are two types. Because the medicative are the normal drugs you use to treat your illness. People overdose it too. So also the psychoactive drugs like the cocaine, heroin, methamphetamine, marijuana, people also overdose or misuse it too. But the point is that there should be a policy on ground that can help reduce demand. You get it now? But the way you can help people to reduce demand is through decriminalizing. When you decriminalize a drug user, the person can easily come out to talk about issues affecting him. You can say, yes, I'm overdosing drugs, I need help. Because when we go to the field most times, some of them will tell us when we are giving them HIV prevention intervention, say, guy, I want to stop heroin. I need help. They say it confidently, say it to you. But can they go outside and tell a doctor, a health professional in the clinic that they need help? How would they be looked at? Or maybe in the police station there, they say, I'm not a criminal. I'm just a drug user. I need help. Can they tell a policeman that? Do you get it now? In other countries where drug users are picked up, by some of them link them to treatment centers. It's not linking them to prison, putting them in kirikiri. No. You link them to treatment centers that embrace public health principles. Like in Kenya, for instance, if you are overdosing on heroin, they place you on methadone. Methadone is a receptive drug gotten from heroin itself that blocks your love for heroin at the end of the day.
Okay.
So you are constantly taking a substitution treatment called methadone. And methadone brings you back into the society, it reintegrates you and make you to be an active part of society. We've seen a lot of women. I've gone to Kenya, done a lot of programs in Kenya. I've seen a lot of people who were already out of the society. But today they come back. They are now businesswomen. They will tell you, I am a methadone patient. They go to the market and sell things. They are married. Some of them are bankers. They carry their card along. I'm a methadone patient. I take methadone and I've come back to be part of the society. They have a good reintegration system whereby the family is also involved in the treatment process. Not only the clinic alone. Family, friends are part of the treatment process. So at the end of the day, you don't see that person as a criminal. But you see that person as a human being that needs help and that could be brought back into the society.
All right, this one will be my last question.
Yeah.
Now, let's come to those who should play major roles in this harm reduction work.
Yeah.
I've had people talk more of pharmacists.
Yeah.
That pharmacists should help in maybe because they also helps in fulfilling this maybe selling of most of these needles in syringe.
Yeah.
That's why I was coming to the angle
Yeah.
of should we say they should stop the drug use or we should just work on the harm reduction. So who should play major roles now, or if not who are the groups, or is it the government that should play major role to be part of this harm reduction?
I think it's a comprehensive approach.
All right.
Approach is holistic, starting from our legislation. Because the reason why we don't have good and improved programming in Nigeria for all key target population is because of legislation. The government criminalizes men who have sex with men. The government criminalizes female sex worker.
Okay.
The government criminalizes persons who use drugs. So if you criminalize them, then we don't have programs that can be able to address their needs, both psychologically, health-wise, and mentally.
All right.
So it starts with the legislation. How can the government make the legislation a bit more compassionate so that public health principles can be given a chance to rule? One. Number two, if the legislations are there, how well are we training public health professionals to identify needs that are affecting the community through proper research? Because with through proper research, good data system, we can be able to know how to be able to program effectively for persons who use drugs. And three, too, we have to also work with our society, the family, the religious bodies, to have to come in place to see how they can help support and not punish persons who use drugs through good reintegration system. They have to be educated, too. The communities have to be educated. Families have to be educated that if your son is a drug user, you don't throw that son away. But one thing is that you have to identify ways you can help that son to be reintegrated back into the society. And believe me, if you do that, that young man or husband can be the best person the society really needs at a particular point in the future.
All right, what will be your last word then? Today's Word is Day,
Yeah.
and I think the hashtag is on, if I could remember, is we should make people count.
Yeah.
If I could remember, I also want to make people to be accountable for everything and also not to stigmatize people around us.
Yeah.
So your last word relating to harm, drug use, and HIV and AIDS as a whole.
My last word is that we should, our government, people, generally every one of us should be able to develop good accountability mechanism. If we are not accountable to ourselves as a nation, if we are not building good partnerships, and we are not transparent, we cannot be able to impact on our health system. And the most important thing the government should start addressing now is health and education. Because without these two, a nation cannot move forward. And the health system, the health issues are very broad, including education. So we need those transparency. We need transparency, actually. We need accountability, and we need good and effective partnership. Government should be willing to partner to see how it can move its health system and education system forward. By that, we can be able to see the good benefits and the cost-effective benefits of harm reduction in Nigeria.
All right, that is it. We want to appreciate Mr. I already call him Dr. Dr. James Egage, the director of ERA. ERA is the Equal Health
Rights Access Advocacy Initiative.
We want to appreciate you for joining us today on Health Matters.
Thank you very much.
Thank you so much for, I think, making people out there to really understand many things.
Yeah.
When it comes to issue of harm reduction, the best strategy and what we need to do.
Yeah.
And I know individual government health professionals be able to pick up something. And actually, those are going to listen to this program on the podcast or the YouTube section. All right, Health Matters still continue after this break. Don't go away. It is still Health Matters. And when we come back, we'll look at many things around the HIV and AIDS, what is going on today, and what you need to know. Listen to Fact Sheet on HIV.
Thank you.
This is Fact Sheet on Pinnacle Health Radio. HIV continues to be a major global public health issue, having claimed more than 3.5 million lives so far. In 2016, 1 million people died from HIV-related causes globally. The human immunodeficiency virus, HIV, targets the immune system and weaken people's defense system against infections and some types of cancer. As the virus destroys and impairs the function of immune cells, infected individuals gradually become immunodeficient. Immune function is typically measured by CD4 count. Immunodeficiency results in increased susceptibility to a wide range of infections, cancers, and other diseases that people with healthy immune system can fight off. The most advanced stage of HIV infection is acquired immunodeficiency syndrome, known as AIDS, which can take from 2 to 15 years to develop, depending on the individual. AIDS is defined by the development of certain cancer, infections, or other severe clinical manifestation. Back to HIV. HIV can be transmitted via the exchange of a variety of body fluid from infected individuals such as blood, breast milk, semen, and vaginal secretions. Individual can become infected through ordinary day-to-day contact, but individual cannot become infected through ordinary day-to-day contact such as kissing, hugging, shaking hands, or sharing personal objects, food, or water. So back to behavior and condition that can put individual at greater risk of contracting HIV. Having unprotected anal or vaginal sex. Having another sexually transmitted infection such as syphilis, herpes, chlamydia, gonorrhea, and bacterial vaginosis. Sharing contaminated needles, syringe, and other injecting equipment and drug solutions when injecting drugs. Receiving unsafe injections, blood transfusion, tissue transplantation, and medical procedure that involve unsterile cutting or piercing, and experiencing accidental needle stick injury, including among health workers. Listen to this. Testing for HIV and other STI is strongly advised for all people exposed to any of the risk factor. This way, people learn of their own infection status and access necessary prevention and treatment service without delay. HIV can be suppressed by combination ART, consisting of 3 or more ARV drugs. ART does not cure HIV infection, but suppress viral replication within a person's body and allows an individual immune system to strengthen and regain the capacity to fight off infections. There is no cure for HIV infection. However, Effective antiretroviral ARV drugs can control the virus and help prevent transmission so that people with HIV and those at substantial risk can enjoy healthy, long, and productive life. This is Fact Sheet, brought to you by Pinnacle Health Radio. For more details, check our webpage www.pinnaclehealthradio.org and remember to follow us on all our social media platforms.
Yes, it matters, and that was Gage James, or the director of Equal at. I think I'm trying to mix that up. That is Equal at Advocacy Initiative Nigeria, back with us, sharing with us something around harm reduction for HIV prevention. If you are just tuning in, I don't want to say you've missed out, but you can still get that section with director of which EHRAA on our podcast section in the next 10 hours. All right, back today. It is about World AIDS Day, and this is 1st December 2017. I can remember the slogan is everybody can't. WHO is advocating for access to safe, effective, quality, and affordable HIV services, and majorly medicine diagnosis and other health commodity for all people who need it. If you listen to that fast sheet, we are trying to make people to understand that HIV continue to be a major global public health issues, and it has claimed more than 35 million lives so far in 2016. And that is we work with data and health, and around 1 million people die from HIV-related causes globally. So you should understand many things around that. I think people try to mix HIV and AIDS together. HIV, the human immunodeficiency virus, targets the immune system, and it weakens the people defense system, also against infections and some types of cancer. But the one thing you should know is that the advanced stage of HIV is what we know as AIDS. That is acquired immunodeficiency syndrome, and it result make us understand that which it can take from 2 to 15 years to develop, depending on the individual. And AIDS is defined by development of many things like cancer, infection, or other severe clinical manifestation. The symptoms vary depending on the stage of infection, though people living with HIV tend to be more infectious in the first few months. Many are unaware of their status until later stages. That is why more advocacy is coming up for people to go for testing. Testing is not for you to scale away. You can check our social media platform, especially the one on Facebook. There's a graphic picture there of some things you need to know when you are trying to go for HIV testing. One thing you should know concerning transmission is HIV can be transmitted via the exchange of a variety of body fluid from infected individuals such as blood, breast, milk, semen, vaginal secretion. But people cannot be infected through ordinary day-to-day contact, such as kissing, when it's not the deep kissing, hugging, shaking hands, and sharing personal objects or food or water. But there are a lot of risk factors. Most of them are more behavior. And if you look here, what we have there, majorly today on harm reduction, when you're having some unprotected sex and you're having the sexual transmitted infection, you're having another, talking about syphilis, gonorrhea, and a lot of bacterial vaginosis, maybe sharing contaminated needles, syringe, and all the injecting equipment and drug solution. And also you can be receiving some unsafe injection. So that's why you must be very, very, very careful. And that is why HIV testing should be voluntary. But we are trying to tell people that you can reduce the risk of HIV infection by limiting exposure to this risk factor. You know, there are a lot of killer approach for HIV prevention. That is why HIV testing is very, very, very important. So we're telling you to go out there. Testing for HIV and other STI is strongly advised for all people exposed to any of this risk factor, because that's the best way to know your status, and you don't need to run away. Whatever the result might be, We have people who are still living a number of years, living healthy, shining, and still doing everything they need to do while they were tested positive. So you should know that's not the end of the life. So it is a big word for us today coming from Pinnacle Health Radio for you to understand that you don't need to miss out on HIV prevention or treatment. The one thing you should know first is go and know your status, and that is it. So, dear Nigerians, dear friend that you're listening today and tuning in, what is your status? Yes, you need to know your status, and remember, you can't get HIV from the following: from kissing, from hugging, from sharing food, from insect bite, from toilet seat. From breathing and sneezing and cough, and also from sweat. All these are just myth and misconception. And when we come to myth and misconception, they are just words that go globally, but they are not scientific. They have not been scientifically accepted or proved. So you should take note of that. You can get more of that fact sheet on our YouTube page and also on the Pinnacle Health TV page. That's at PHR TV on Facebook and on Instagram. It is at Matters today. I really learned a lot today when it comes to matters around harm reduction. See, thank God Mr. James was trying to open our eyes to see many things we need to know. It's not that people need to criminalize those who use drugs, but we should come to a level of coming up with the best policy that will help them. So I believe you learned a lot today. Remember, it is Ed Matters, a platform where you are persuaded, you are educated, you are informed the best practice when it comes to healthy choice. I remain Samuel Alabi. I see you on Monday for another fresh episode of That Matter. Before I go, let me share this program with you. It is called Hello Health Expert. This is a platform whereby a lot of questions pondering the minds of people out there are answered by our verified health expert, from a medical doctor to nutritionists, the dietitians, and a lot of them the medical field. So if you have a question out there, you can use many of the platform. You can send them to this mail, ask, that's ask@pinnaclehealthradio.org, or you go to our website directly, pinnaclehealthradio.org/expert. I take it again, pinnaclehealthradio.org/expert, and there's a form you will fill there, put in your question, your name, your location. We actually want to know where you're writing it from, and that question. And stay tuned. A program coming up on air whereby our doctors will be providing answer to that question. And also, you can use any of our social media platform to forward your question to us. It is a wonderful time. I want to tell everybody Happy New Month, and I think this is the season greeting. Okay, this is just a amateur season greeting from us here today on Pinnacle Health Radio. Enjoy yourself. 12 noon today, Emotion Toolkit, and yes, Emotion Toolkit today, and more program coming up after Emotion Toolkit. Stay tuned. It Matters is about you making healthy choices. I'll see you on Monday. It is Ed Matters on the wheel. This is Ed Matters on the wheel. Trust you doing fine. Don't go away.
The baby needs a TV for the mother. A child is meant to play. Oh, it's a time to bond with my child.
The child is thinking of something that is natural as a disease. It will affect the way they manage those conditions.
Single. Some people don't know that you intentionally set some goals for your family.
But there's so much more we need to do when it comes to mental health in Nigeria, because we have one psychiatrist to 1 million Nigerians.
It is Health Matters every Monday and Friday on your number one health radio, Pinnacle Health Radio. Download our 100 app on Play Store or listen via www.pinnaclehealthradio.org.